To the Kirkwood De Pere Area Chamber's Biz2Biz Adapting to Change webinar event. This multi-part series will give businesses and services from throughout our community the chance to share what they are doing to assure the safety of their employees, customers, and clients. Each continues to adapt their business practices to meet dramatically changing needs and expectations. Their journey may surprise us, it may encourage us. It'll certainly teach us how they have changed the way they do business for the benefit of all of us. I'm Joan Pace of alwaysaboomer.com, presenting sponsor of Biz2Biz Adapting to Change. I write clear, concise, and responsive copy for your marketing, website, blog, and fundraising needs. The sponsor of this webinar, which will highlight senior services and disabilities within our community, is Martha's Hands Home Care Services. I introduce to you Andrew Huber, Chief Operating Officer.
Thanks, Joan. I appreciate it. And welcome, everybody. We're excited to be here. We're glad to be a sponsor of this event with the Kirkwood De Pere Chamber of Commerce. So a little bit about Martha's Hands. Trust. Isn't that our goal? Everybody's goal is to gain trust, and it's gained through our words and our actions. Trust is gained, not that we're going to be perfect in what we do, but it's what do we do to try to mitigate bad things from happening, and if something does go wrong, how quickly and how responsive are we to our clients and our team members. Trust from our clients and our families that we will care for them like they're our own family, and trust from our caregivers and team members that we will support them as if they were members of our own family. Again, trust being the key. And for over 23 years, Martha's Hands has earned the trust of over 10,000 families to care for their loved ones. We have had over 5,000 caregivers partner with us in this effort. And when people ask me and others on our team, why should we select Martha's Hands? The difference comes to our tagline of compassion and excellence in home care. Compassion is based on our mission-based approach to care. You got to hear from Eileen a little earlier. Eileen is my mother-in-law, but more importantly, she's the founder of Martha's Hands. She was trained by the Sisters of Mercy to do her nursing training. And they talked about that nursing was more than just a care, but it was also about service to God and God's children. And so she took that personal mission statement and embodied that throughout her career. When she founded Martha's Hands, she built that mission into the core of what we do. And it's embodied in a Mother Teresa quote of we serve with our hands, love with our hearts, and seek the face of our Creator and those we serve. And that's not just slapped on our letterhead, but that's really the core of all the decisions that we make here at Martha's Hands. Second is excellence, and that goes back to our nurse care management approach. Eileen, being a nurse, always felt that everybody deserved a nurse who was going through care issues. And so we not only have one or two nurses, but we have a team of 12 nurse care managers to oversee the care for all of our clients. So in case they have any questions or concerns, that they can reach and talk to a skilled nurse about those. Just as important, we have those nurse care managers available to our caregivers. So when they need help and support from a clinical standpoint, that there's a nurse available to them 24 hours a day, 7 days a week. So it gets down to trust. Now more than ever, that's going to be the difference in what makes us successful during this COVID time. So that's a little bit about Martha's Hands. I'm pleased to be on this panel with 4 wonderful individuals, and I'm going to introduce them. Charles Fisher with Canterbury Enterprises, Vicky James with Chapel Hill and Oak Hill Mortuaries, Christy Cridenhour with Manor Grove, and Steve Miskovic with Care Choice Care Management. And each one of us serves the senior or disability population. And so what we wanted to talk about, the fundamental question is, what ongoing steps are we taking to mitigate the COVID-19 risk for our clients and our team members so we can continue to operate regardless of whether we have a spike in cases or not here in St. Louis. What are our ongoing efforts? So I'm going to start first with Christy Ridenour with Manor Grove. Christy, why don't you talk a little bit, explain what Manor Grove is, and then what those steps are that you're taking to mitigate the risk to clients and to team members.
Sure, thank you. Yes, my name is Christy, and I'm the community liaison for Manor Grove Nursing and Rehab in Kirkwood. We are a nonprofit nursing home and rehab, and we have 117 beds that we can cater to our residents. And what I think special about Manor Grove is that we're intimate, boutique-like, and we get to know each one of our residents. And I'm personally proud of that because that's one of my favorite things about being inside Manor Grove. And even with this pandemic, I'm inside more, which gives me more of a chance to, like, my personal role has changed a little bit, and I get to spend more time with them, not super close to them, but we all have gotten to know each other even better, more. So I think that's actually a good positive thing that's come out of it. To answer your question about how we're always, trying to mitigate the next steps, really, I feel like we've a lot of it is just always following the CDC guidelines, but also for us, and I know all of you too, like for us, it's just the residents first all the time. It is all the time the residents first, even before the pandemic. So now it's like making sure that they're first. That's how we always mitigate going forward. Constantly, like, we wear masks, we social distance, and then we just come up with special ways to keep our families connected. So I kind of feel like a lot of our adapting has been at the front. So now we're just really on a roll with what we've learned how to adapt to.
Great. And then for your team members, what types of steps are you taking to help them, obviously in their personal role there, because obviously they can't physical distance when you're giving somebody a bath or a shower. So what types of things are you doing to help mitigate the risk to them, and how you're supporting them through this challenge?
So it's, again, like back to all those guidelines. I mean, a lot of it is just the common sense of like having the mask and all of our PPE gear and kind of monitoring each other. Like, you got to take that mask off always. Like, when you changing it all out, like in every single room, we have to literally, you cannot go into another room with the same gear on, which is even if you don't touch anyone or anything. And so kind of keeping an eye on each other. I hate to say babysitting because that's not the right word, but I'm a mom, so that's what comes into my mind first. It's not that, but it's like keeping each other accountable. But we always have to remind each other that. So we come up with games, if you will, to kind of remind each other all the time. When we see someone doing something right, our whole goal is to lift each other up in all of this, or one of our goals. So when we see someone doing something right, we can go on the overhead announcement, or, it's kind of that recognition that keeps people wanting to do the right thing.
Yep. There you go. Very good. I'm going to pass it now on to Steve Miskovic with Care Choice Care Management. Steve, why don't you talk about what Care Choice Care Management does, and then how you've made adaptations to work with your clientele and their families.
Good morning, everybody. So as Andrew said, my name is Steve Miskovic, and I'm one of the owners of Care Choice Care Management. My wife is the other owner and my boss. So I've got to be careful what I say. She might be listening in this morning. So we are a group of care managers, and so what that is, we help coordinate care for all types of families, persons with disabilities, mental health issues, and then of course older adults. And so we take the approach of getting to know the clients, meeting with them one-on-one. But one of the things that we have to be careful with our business when we're working with a family, sometimes they have their own expectations, and maybe they don't coincide with what their parents want or what the person that they're caring for wants. So we really have to kind of merge those two together. Oftentimes we act like a mediator, but our real goal is to help improve healthcare for the seniors and the folks that we work with, those with disabilities, those that have special needs. And so we take the approach of, as my wife and I are licensed clinical social workers, we have nurses on our staff. We have a couple of people with their masters in gerontology. Janelle, who was on this Zoom call, she's one of our care managers. Hi, Janelle. And so we will take care of them from A to Z. So I'll give you kind of a quick example. We've taken a person who was living by themselves with dementia, had no family in town, and we're able to move them to their family up in the East Coast. This was last year. We were able to sell their home, have the money there for him, because that was his biggest asset, and that will pay for his care. And then his sister, who is his caregiver up on the East Coast, she was very relieved that we were able to kind of come in and take care of all that. And we did all that within 6 weeks. And that was a lot of time and effort, but that's one scenario. So as far as what we are doing now to kind of mitigate the issues, obviously we have to take all of the CDC guidelines and use those. You know, some of our social distancing is kind of forced because we have clients that live in assisted livings or in other nursing communities. We obviously can't see those folks face to face, but we still have been seeing them through the window, making visits, dropping things off to them, calling them regularly, staying in touch with their family. But other folks that live in the community, we still, I was transporting a couple clients over the last few weeks to their doctor's appointments. They sit in the back seat. We're wearing masks in the car. I don't necessarily sit in the office with them because they want to, obviously doctors' offices want to minimize the volume of people that are in their offices. But then I'm following up immediately with the doctor afterwards and knowing what took place. So it's been more phone calls for us, I think, but now we're starting to see more referrals come in because families are, they're not going to be at home as much anymore. They've got to go back to work, or their schedules have changed. They can't manage mom and dad's care and school their children if they don't go back in the fall. So we're starting to see more calls and trying to coordinate that care. And that might be bringing in Martha's Hands to, provide that companionship, provide the personal care and the homemaker type of services. So lots of hand washing, that we've all done, lots of social distancing, and lots of phone calls from our end.
Yes, definitely. Hand washing. I've never realized how often I touch my eyes, my nose, and my mouth until the CDC said, don't do that. So it's amazing that way. Next up is Charles Fisher. He's with Canterbury Enterprises. And again, Charles, why don't you tell everybody a little bit about Canterbury Enterprises, and again, what things you're doing, not just for clients, but obviously for your unique team members there as well.
Sure will. First of all, thanks for this opportunity. I really appreciate this, and nice to meet everybody if I haven't met you in the past. Canterbury Enterprises is a workshop. We employ people with disabilities. It's shelter workshop by the state name, and we give them work in our facility every day, Monday through Friday, all year long. They're hired just like all of us are. We are a nonprofit. We had about 80 people with disabilities and 12 staff before this pandemic started. We plan to bring back as many people as we can, but right now we have close to 40 people with disabilities back. So it's been a tough ride for all of us, we know, and because we do production work for businesses. They will outsource the work to us, and our guys will get paid to do that, and we'll charge the customer, and that's kind of how it works. And we get some funding to help with the overhead because there's not, it's basically what we charge businesses goes back into the employees' hands because it's a job for them. But for them, we're creating an environment for them that promotes their dignity and encourages independence and gives them that sense that they're contributing members. It's a wonderful. So like I said, it's been difficult. They're confused, like all of us are, and it's we had, first thing we did, and we're helped by DESE, Department of Elementary and Secondary Education helps us out. They always have. We're partially funded by them, but we follow OSHA regulations and DOL regulations through them. And then along with the CDC and the guidelines, we put together some good policies and procedures. We created committees. We created what we called a retaining or bringing back employees committee, returning employees committee, and we had to have a training committee and then a safety committee. So, you know, for example, like what we all do, we check temperatures when they come in, and we clean everything we can. For 6 weeks, we had a company come in and do sanitizing and fogging through the whole facility. We stopped that now because it kind of leveled out and we can keep up with it. But that helped, and it helped teach my staff that, you know, that was the most important thing too. My staff are really in tune with what we need to do. We stayed here the whole while. The employees, we had to shut down because we didn't know what to do, and the transportation is also a funded source, so that closed. You know, Oats transportation, some of you see their vans, all of that stopped. So we basically had to shut down as far as our services to the people with disabilities. Now, to maintain our work level, staff, myself and others stayed here to do the work ourselves, just to keep things going, because even though we lost some work, because we do a lot of Easter egg business and stuff like that, we lost that. We gained some other stuff because we also bottled jobs for soap and sanitizer maker. So we gained stuff, we lost more than what we gained, but we're trying to figure out how to do that. So with the staff, we right off the bat, I talked to my board of directors and we approved a extra money for them to come in here, even though we didn't feel like we were. I mean, there's 24,000 square feet here, and there was only like 6 or 7 of us coming in. Some of them were working from home. We didn't feel like we were in danger, but we did support them with more income during that, like nurses and other people do. So that was helpful to them, because we needed to maintain our business. Otherwise, we didn't want to lose it. And we also gave them a couple extra weeks vacation time to use if they needed it, to add on to their benefit hours. So that was the benefit that we gave to our staff. As far as the employees go, at first I was doing videos. I mean, it's all about, as most of you know us and know the system, it's all about them and making sure they're happy and content with their life and content with whatever we can do for them. So I was sending videos. My wife was helping me from home. I was sending videos, safety videos and washing your hands videos, and it was fun. I was showing them my dog and stuff. And I was getting feedback. I was sending obviously to their parents' email address or their case managers, whoever can send it to them. And we were getting some positive feedback. And then we just then as things went on, we started to train them more on the safety and what to do, and try to teach them what's going on with this situation. And then we started bringing people back, and it continues. We still have the returning employee committee. It's very delicate. We talk to families individually, because it's not just about if we're ready for someone to come back. It's about how they feel too. And, you know, some people are way more sensitive, and we have to, you know, even though we may want little Jimmy back here because he's high producer and we're doing a job that he can do really well and he can make good money on, they may not want to come back. So we have to cater to what their needs are too. It's been a challenge to get stuff done, and we're trucking along yet, but we're still. And then the hard part is when you have the people that we're not quite ready for them to come back, and maybe their parents aren't quite ready for them, but they don't know that they're not ready to come back. They want to come back. They don't know what's going on. Why can't I come back to Canterbury? And that's the tough ones. And some of them will call a lot, saying, when can I come back? Or their caregiver will call, when can so-and-so come back? So we've done different kinds of things. We of course, we do the temperature checking every day, and we record it. We assign one person to do that. We have to, the same person is the person who the staff person will be the one that we have to tell them to wash their hands, and we have to explain to them and to others that that's how important it is and how many people are allowed in the restrooms at a certain time. but again, it's all about their safety, and everybody's working together to make sure it's right. And you know, there's been some difficult people that don't understand. They pull their mask off, but they're all wearing masks, and they just don't understand. And we're helping them. And it's been to the point for full-time people. Some of them are actually only part-time yet because they're still trying to get used to it. And some people that we brought back full-time still couldn't figure out how we're having a hard time. So they have to go down to part-time, and we're working with the parents. Parents have been wonderful. Family's been wonderful. They've been helping out. And there's some things with the some of the transportation is going again and some is not. So it's been constant juggling, and we've all had to change our roles here, the staff. It's just, all in all, it's been wonderful, and we're happy to see everybody coming back gradually, and we hope things will bounce back for all of us someday. I've got a 6-page procedure manual on it that I don't think you want to hear, but we've got different levels, phases of levels: red level, orange level, yellow level. We did have one. We haven't had any cases here, so that's been a blessing. We had one person that I know of that had a high temperature yesterday morning, but then later on we checked and it was fine, and I think there was something wrong with it. You know, the thermometers are really iffy sometimes, so they double check it a couple of times. She's fine. So everything's, you know, we quarantine people then, you know, if something happens. So that's part of our policy. If someone is high temperature, we keep them in the lobby area and call their parents or caregivers and to come back to get them, because buses don't just wait, they drop them off. Yeah, that's how that goes. But yeah, it's a whole different kind of fun.
Yeah. Well, and I think we're all appreciative that you are being very sensitive to your team members and their families, because yes, you'd like them to come back and like them to have that financial income, but you're also looking at them as individuals and as people, and really care about each one of their specific needs and feelings. And so I think we all appreciate that you're doing that. So thank you, Charles.
Thank you.
I'm going to keep my fingers crossed. Vicky, do we have audio? I'm going to keep my fingers crossed.
Can you hear me?
Yay!
Can you hear me? Yay!
Hey, Vicky.
So
I can learn. I'm old, but I can learn.
So we're very glad to have Vicky James from Chapel Hill and Oak Hill Mortuaries. So Vicky, tell us a little bit about how you're handling this. So, because I know there people were stopping having funerals, and there's been all sorts of, obviously, restrictions that have been placed upon you all by government entities. Kind of tell us what steps you're taking for the people coming in and for your team members too. So.
Sure. Well, since we are an essential business, and we work with people in a very emotional time that want to customize, we customize the services however they want. We are in 3 different counties, so we have to pay attention to 3 different sets of guidelines. So that's challenging within itself. But as far as the families go, they've been very understanding. We have had to put very few funerals on delay. We have 2 right now on the board that want to come back at a time. But in Jefferson County, there's been a window of opportunity here, and still they don't really limit the numbers. So some people are choosing to come from that would have used the Kirkwood location, or coming out here to have their services. So that's one thing that we can do to adapt to that. But we also had a service for a young man that was 13 that passed away from cancer. And so we did not want to have to limit the numbers. At that time that he passed away, you could only have 10 people in the room at the time. So we had a 13-hour visitation for that family, brought 10 people in at a time, totally cleaned the facilities in the bathroom, and then we would let the next 10 in. So we came up with a number system. People sat in their cars. We text them when we were cleared out with the first 10, and then we would just rotate people through like that. So if people wanted to have a service, we haven't had to tell people that they can't. It's just sometimes they have to understand it's a long day, and you know, so we've adapted to that. We have masks at the front door in Jeff County for anybody that wants to use them. Because it's optional here. But in Kirkwood, we have them at the door and insist that everybody use them to follow those guidelines. Our staff, we've limited entry into the building as far as mail deliveries and things like that. Everybody stops at the front door, drops everything there, and then that way they're not coming into all of the offices. The staff also, at the very start of this, took the responsibility for their own area, and every 4 hours would clean the area that they work in. So our staff has been very accommodating, certainly understands what we do, and know that we have to stay open. So one of the things that became challenging is for our young parents that had kids at home is when they had to try to be a teacher after work, that was getting difficult. So what we did for those individuals, we gave them the option of working 10-hour days. That way they had a whole day at home that they could work with, you know, their young children to help them stay up with their schoolwork. So that was one of the things that we did for staff. But every day it seems that there's a change, and we're just having to stay on top of it. We do have to go into people's homes for when we get first calls. So, you know, we're very diligent about, you know, washing hands, keeping sanitizer with us in the cars as we come and go from people's homes. When we have the guest book here for people to sign, we sanitize the pens in between. We just have a bin of clean pens, and then, you know, just keep re-sanitizing them. So there's just lots of things as we were working through the services, like, oh, we didn't think of that. We just all put our heads together and came up with a solution for what we needed to do to keep everybody safe.
Have you had to do, when you're meeting with families and in the planning stages, are you doing any more via like Zoom meetings or things like that? Or people still like to be kind of with you and kind of have that really intimate connection while they're planning?
That has picked up some, just because of the fact that some people aren't traveling right now, and if their parents or their loved one lives in Missouri and they live in a different state, or they pass away in a different state. We've had a few people pass away on vacation and had to bring them back to Missouri. So there is some of that, but the majority are still face-to-face meetings.
Gotcha.
So, you know, in conference rooms, when you're in close proximity, then, you know, we stress the mask, to use those in the small conference rooms.
Yeah, great. I want to go back to Christy. Christy, you know, you hear on the news about the frustration or the sadness that people are experiencing of not being able to see their loved ones because of kind of orders to stay, that the licensed care communities aren't letting guests in and people in. Can you kind of talk through a little bit so people understand why what kind of restrictions are currently in place as a licensed care facility, and maybe unique things that you're doing to try to work around that to help people connect?
Yes. So first of all, like, nursing homes are the second most regulated industry. It's actually nuclear power plants are the first. So we're the second. So our regulations are just, it's awesome for our residents and everything. And that's the whole point of it, being safety first and not residents number one. But that's one of the reasons why. And I think some people, you know, sometimes I think families might feel like, well, say, you know, residents first means my family or my resident needs to see me, which we understand. But our first thing is that virus is not coming into Manor Grove. No way. So one of my favorite things, and I'm so glad to share this because I did want to be able to share this because people can maybe take this idea back to their place, is, so we have window visits, but the windows have to be shut. So it's sort of like you see each other, but you can't hear each other. So one of the things that we came up with is someone had a karaoke machine. And so, yeah, and so we have the karaoke machine inside our building, but then you can slip the microphone cord and, you know, on the other side so the family member can talk, because really it's the resident that typically has the hard time hearing. Yeah. So then the family member can talk like normal, but it's super loud on the other side. And I feel like, oh my gosh, and listening to all of this, I thought, just one of the things that we came up with, but I feel like, ooh, maybe you could use something like that inside a car. If you wanted to have maybe like a clear shower curtain, just something inexpensive, like in a car. Yeah. But then have like that easy microphone kind of thing. Like maybe you have a karaoke machine, or your kids probably have like a little one or something. So I just feel like that's just one idea that we've come up with that has been, it shows the families we're on it. Like, we know we miss you, we miss them too. And we know they miss their family member, but this is ways of like, we can be like show our love to everybody. Yeah. To keep them connected.
And not that you have a crystal ball or anything, but is there are you hearing about any guidance about when they will start loosening up some of those regulations? Or, you know, obviously different communities have different levels of licensure between nursing home and assisted living, but are you getting any sense of if there's going to be any loosening up of that? Or
So my feeling is it's not going to be loosened up for nursing homes anytime soon. But like, for example, we're COVID free right now. And if we stay COVID free for a certain amount of days, then we can start doing the outside visits. So we're sort of in that realm. So we are super excited because we're getting close to that. But we also are doing testing all the time. So that could always change. So that's sort of the testing, though, is so important, obviously, for obvious reasons. So yeah.
Oh, great. I want to go back to Steve too, real quick. Steve, obviously you do some care for people in communities like Manor Grove, and obviously you're sometimes restricted from going in just like a family member. What other kind of creative ways or things that you all have done to try to work around some of the restrictions, whether they be in a licensed care facility or just other types of care settings? Is there any kind of an example of a unique way you kind of worked around that?
I think a lot of it has been really talking to the administrators and the social service team at the communities to explain, especially for a lot of our clients who might have a lot of mental health issues, whether it's, you know, bipolar disorder, depression, schizophrenia. Those folks need a lot more support, and being isolated like they are, can't get out like they were used to. So it's really about to help them know that, okay, yes, we understand all the COVID guidelines, but we have to make some exceptions, or at least we have to do something a little bit different for some of those more isolated folks. And so, you know, kind of like what Christy said, I'm actually, when this call is over, I'm going up to Bridgeton for one of my clients that lives in a nursing home. I'm picking up pizza. I'm going to give him his little pizza, and we're going to sit between the pane of glass. But he uses his cell phone, so we'll take a couple bites, then we'll call each other. Then we'll take a couple more bites, call each other. They're back. Just this week, in RCF, where I have a client, they're allowing the social workers and other case managers to at least come and support them. And so we have to get our temperature checked and everything, but at least we can see him face to face. So I don't say that we've done any, there's nothing been unique, but it's just been a lot of dialogue about the importance of what these folks need that maybe they didn't, that maybe the team where they live didn't quite know, because they were able to get out more often, and so they had that outlet. So we just have to be really on top of making sure that that they know how important some of these contacts are, and then encouraging our families that their siblings or whatever the relationship is, like, okay, it's okay, make that call ahead, set up that window visit, even though you can't touch and see them, you can't give them a hug, don't not attempt to go. I think that's sometimes families have kind of felt like, oh, I can't even go up there, and so we try to make those kinds of arrangements for folks.
That sounds good. I want to go to Charles now. Charles, with return to school, not quite sure. Obviously, that seems to be kind of up in the air, and the population that you have, how is that going? How does that affect you and having them working or not working? And are you getting any kind of guidance from Desi and others? Can you kind of talk a little bit about that?
Well, yeah, the Desi part there is just a whole separate division for the sheltered workshop. So
Okay.
It's funny, we don't overlap with the school part at all. And
Felicia, you have a call?
sometimes there's been talk over switching us to like the economic development department, at the state. But Desi's been very helpful. Not really. As far as schools, it has nothing to do. We're individual nonprofits, so Desi doesn't have any say on what we can do. There's 80 workshops in the state of Missouri, and a couple of them are still shut down because of their situation. But overall, there have not been many cases in the shelter workshop program. More so, the problem has been the loss of work because of other businesses.
Yeah.
And like us, my biggest customer is all events base, American Carnival Mart, and so they're really hurting now and trying to figure out how to get through that. But it's been I just lost the viewing, but the school doesn't affect us unless it affects the individual families.
Gotcha. And I'll go back to Vicky. Vicky, has there been any, whether it's regulatory, unique things that people should know about if they're having to either pre-plan or plan during this time that is different, and so that they should either take into consideration?
There are some funeral homes that do not do COVID cases at all. So that has increased our business because Brian, says people that you need to have services regardless of how the person passed away. So we don't turn anyone away. So that might be one thing that people would be surprised by. That, they may have a pre-plan at a certain funeral home, and then it comes time and they, aren't taking COVID patients or customers. But pre-needs do transfer. So we've picked up some cases like that for other funeral homes that just don't have the facilities or the resources to do the COVID embalming. So that might be one thing that would surprise people. And then, there's some funeral homes that just say 10 and that's it. When we had the restriction, Brian just tried to be a whole lot more flexible. Even though 10 could only be at the gravesite, he would let people, as long as they stayed in their cars. And then, they could hook up to our speakers with Bluetooth on their phone and get to at least hear the graveside services. So we try to accommodate everybody and try to be as creative as possible. Some smaller funeral homes don't have resources to do those type of things. So that might be some of the ways people might be surprised.
Gotcha. Well, thank you all on that. From a home care perspective, I'll bring that in here. So a lot of people wanted to stay at home and keep their loved ones at home because of fear of whatever, or not being able to see their loved ones during those initial days. So actually our business has been booming during this time, but it's really, it kind of goes back to the caregivers. Is we always had a viral protection program. It just went on steroids come mid-March. And so we had not mandated masks before COVID-19. Obviously, that was a big thing. So just the supply chain of getting masks, getting gloves, we're kind of the last person in the healthcare totem pole, if you will. The hospitals got it. The nursing homes hopefully got theirs. Private pay home care, we had to, grab from here, grab from there. I was driving 20 minutes just to get 3 boxes of gloves because we needed them so desperately. So it was just, is having that personal protective equipment, the gloves, the masks were very important. And we make sure that the caregivers are protected. Some of the things we did to kind of put that on steroids was we didn't want the caregiver to have to choose between money and safety, their safety and the safety of our clients. And so while we typically would ask them to call ahead if they were going to be sick and not at a shift, we stress to them, if they're about to open the door and they don't feel comfortable as far as their health, to call us, and that would not be a disqualification or a punishment. We'd rather they not go in that door if they felt sick. And again, we went through the protocols on COVID-19 symptoms, and we would not hold that against them. And if they went, they would have to then go get a health release to make sure that they weren't COVID positive. But what we did is if they had COVID-19 symptoms and couldn't go back to work, we would sideline them. We paid them for not working. We did that we secured a PPP loan through the Small Business Administration, and we're investing that money into the caregivers to not work if they felt like they had an illness, again, to protect themselves and to protect our clients. So we made that investment, and that's how we are utilizing some of that PPP funding, was to make sure that if the caregiver was sick, we want to make sure that they didn't go in and care for that because they felt like they had to for a monetary reason. We took that off the table. and that has helped us out a great deal. The second thing that we did was more talking about, you're doing all these good steps, washing hands, using masks, using gloves, disinfecting, all the things we talked about. They did a great job in their professional capacity. We tried to stress, you have to take those same principles and apply them to your personal life. It does no good for you to do all these great things when you're with the client and then to go home and not wear a mask when you're in the grocery store and not and touch common used areas like railings in an apartment complex and then touch your eyes. I mean, so we tried to stress that, take those same great protocols that you're doing while you're in your professional life and carry those over to your personal life, because that's where they're probably have the greatest chance of getting infected is in their personal life, because we've all done such a good job in the professional capacities to reduce the risk of catching COVID-19. So we did that with our caregivers and our clients. We did a lot of communication, told them about the steps we were taking, talked to them. We had two what we call potential exposure experiences that we had to communicate out. We did that got up in front of it, did it very fast, where we communicated the potential risk to their loved one, let them know what the potential exposure was and potential next steps. Let me tell you, those calls to adult children were not fun. They were very scary, but to a person, they were all thankful that I called, appreciated the transparency, and asked what they should do next. And none of them left us as clients because they felt like we were on top of it. And so that was kind of a recommendation to everybody. When you got bad news, best to get out in front of it, be transparent about it, because again, it was bad news, but it ended up being, I think, reaffirming that they had trust in us, that we weren't going to hide something from them of a potential exposure to their loved one. And we talked to the families too about, we're taking all these steps, but it does no good if you're not taking some steps to protect your loved one too. So limit the number of visitors that are coming. When the visitors do come, they should be practicing good viral mitigation, wearing masks, wearing gloves if they're going to touch their loved one, maintain physical distancing. We had, and again, this was in March and April, where it'd say, oh, yeah, the granddaughter's coming back from her spring break trip in Florida and is going to stop by and see grandma. So I know grandma wants to see the granddaughter, but she's just in Florida for a spring break. My guess is if she's a college student, might not have been wearing a mask the entire time. Can we do a Zoom phone call with the granddaughter? And those were delicate conversations to have, but we can take all the steps, but if in their personal lives they don't adhere to some of those, they put themselves again at greater risk as well. So that's a little bit about what we did. We did a great job. Our home care industry in St. Louis is fantastic. We communicate well with one another, and I think we've done a fantastic job. So the last quick question that are going to go around the panelists is there one thing that either the chamber can advocate for, either at a local level, a state level, a national level, regulation, things that would help improve what you're doing? So I'm going to start with Vicky. Is there anything at all that the chamber can be advocating for your industry right now during this time?
I can't think of anything. We are involved here in Jefferson County with our local governing in Hillsborough, the county individuals and our council people. They all stop by and talk to us, so we have real hands-on discussions with them. We don't have that many contacts in St. Louis County, but we seem to be navigating okay. So I think we're okay at this point. Okay,
great. Charles, anything that we could be advocating for?
Well, I'm all about the communication, and not that I would want it communicated for us, but I mean, it's hard to keep up on. And I don't, a lot of people are like, I don't want to watch the news because it's all bad news, blah, blah, even before the pandemic. But really, sometimes I really want to know numbers, cases are going up, cases are going down, because I may have a staff person throw some of those at me. And it's like, well, okay, but I haven't researched that. So City of Shrewsbury, where we're located, does send out the county information, which I have found very helpful. It gets a little cumbersome sometimes, but maybe sometimes the chamber could do that. Maybe what the county is going through, just send out a little blurb. Hey, this is what the county's doing here. These are the cases. This is what they're asking people to do. I just think a little bit more information from everybody's perspective may help.
Yeah, that sounds, that again, information, we have understandable information at our fingertips. We can make better decisions. I agree with that. I agree with that. Steve, is there anything from your end that the chamber can advocate for care managers?
Well, I think in a general, I think just to bring the knowledge up with, we all have experienced some bit of isolation over these last 4 months. And I think that for our senior population, our disabled population that didn't get out before, maybe we can all have a little bit more appreciation of what being isolated is, and not take for granted that because you're older, it's not just a fact of life, but it is something that needs to be addressed, because isolation leads to depression, and the rate of elderly suicide is the highest cohort in the country. And so we have these things. So I just think elevating and just our knowledge base to recognize that these things have been going on prior to COVID with our seniors and our marginalized folks. And so now I think maybe we all have a better perspective. So I just think as a chamber and as just the human race, we just need to kind of recognize that.
Yeah, very well said. Very well said. And you're right. Those of us in the industry have an understanding of that, but I think the greater population has understood that isolation is a healthcare concern, especially for the older populations and vulnerable populations. So thank you, Steve. Cindy, is there anything, or probably Christy, I'm looking at another note. Christy, is there anything from the long-term care side that you'd like us to either advocate or understand?
I agree with Charles. It's the numbers and like kind of funneling like the real numbers and things like that is always helpful. Again, we're so regulated that we have to kind of defer to other places. But at the same time, I feel like I'm so pleased. Like I feel like there's all the time like things from the chamber, like explaining, like about the PPE loans and just things like that pretty consistently. I was like, I think the chamber's been great.
Yeah.
Yeah.
I would agree. I would agree. Yeah. Some of the, you talk about stats and I try to dig down. I try to, try to look at the numbers and take whatever political persuasion, try to take that out and really try to get down to how does it affect, our company. And again, we deal with elders. And I think the statistic that really kind of drove this home was the average age of a positive test right now nationwide is like 41 years old. That's the median age of a positive test. The median age of people who've died from COVID-19 is 78. So it is very drastic, the mortality rate for this disease. It is so heavily weighted 70 plus. And when you go to 50 and younger, the mortality rate is extremely low. So that is informative to me to know, dealing with elders, that we are the most vulnerable. We're caring for the most vulnerable population. So we need to be taking extreme steps to make sure that COVID-19 doesn't enter Manor Grove. It doesn't enter our clients' homes. We've got to take those extra steps. So reiterating those to our team members as well. So one thing that we would advocate for, we're talking about in the home care industry, on a national level, they're talking about the next potential piece of money, I guess we call it, funding to help us get through this COVID-19. Two things that are important that need to be part of the dialogue, and I'd encourage us to think about. One is unemployment. The federal government added $600 per week to unemployment claims to help get through the COVID-19 crisis. That ends on August the 1st. They're talking about how they're going to help people who are unemployed going forward. Me personally, and I think us as an industry, want to support those who are unemployed, but that $600 a week was a disincentive to return to work. I'm telling you right now, I could hire 50 people today, 50 caregivers today. I'm turning away business because I don't have enough employees, which sounds crazy when unemployment is over 10%. But we are desperate for employees. And what we've discovered is the caregivers who became unemployed are making too much money on unemployment that they'd rather stay at home and stay unemployed. So I think we need to figure out a way, however we're going to help the unemployed, to somehow incentivize returning to work when they can. And I'm not claiming I have all the answers on that, but the $600 a week bonus on top of whatever the state was contributing became a disincentive to return to work. And I think we need to figure out a more creative solution to incentivize people to return, but still take care of those people who are maybe longer term unemployed. The second thing is they've talked about maybe another round of PPP funding, that Small Business Administration loan. Obviously, I think we've learned a lot from the first one. I think we can definitely learn from some of the errors or oversights from the first round. But as I talked to you about, we use the PPP to basically pay people to not work because we didn't want to risk the elders from getting exposed. And I think targeted PPP to those organizations that really could use it to stand up our healthcare system, our social services systems. I would be obviously advocating for that, something to keep people employed. We in the chamber believe in employment, right? We all want people to be employed. Anything that helps keep people employed, keep them connected with us as businesses, I think is a plus. So I'd be an advocate for another round of targeted PPP for businesses that don't have access to other forms of financial resources. I can't go to the stock market and sell a bond or something. So it's either that or it's out of my kids' education fund. So that's where it comes from me. So, and then at the local level, and again, I don't claim to know all, but the school systems for a lot of people are not just education, but they're nutritional programs, there's healthcare programs, there's after school programs, and it becomes the childcare for a lot of people. And so as we're rethinking about how to do the schooling, if we're not going to be fully reopening, we need to realize that there's going to be a huge childcare need to keep people working, because if they can't find childcare, they're not going to be able to work, then they're going to become unemployed, and it becomes a spiral. So schools reopening and business employment are interconnected. And I think it's important for us to advocate to walk through and see those things and try to figure out a way that we can do that. Terry Sibbets asked the question, are there some changes that you have made due to COVID that will continue to use post-COVID? I'll throw that out to the panelists. Go ahead, Christy.
It's funny because there are so many things that I'm like, wow, we are not going back. Like some of the pandemic stinks, but there's a lot of things that we have learned that we're gonna keep on going with. And one of them is like, you mentioned before about like recognizing and lifting the employees up and things like that. And we bought superhero capes. I feel like we didn't maybe do the best job at recognizing before, because we expect you to do a great job. Like that's why we hired you. And then I think now it's like, no, we need to up that and like show them that we really, really think you are special. So we bought like a Wonder Woman superhero cape and a Superman cape. and whoever our employee of the month is, like, they get to put it on and we take their picture and we like make a bigger deal about them. And I just feel like it's just like, we're never not going to do that again. Like, we're doing that, you know, and I'm going to think of like even more things to make them feel special. So there's lots of, I would love to get other people's ideas on just helping with the recognition. And that's probably another Zoom call, but I just think that the recognizing of the employees is such a big deal, that there's little things like that we're just going to keep on doing.
Excellent. Anybody else in the panelists, things that they're going to continue to do?
I would echo what Christy's talking about. Definitely having to keep your staff motivated during this time is a challenge. And just like she said, we should have been doing it all along. So that's one positive thing, I guess, that will come out of this, is we too have been doing some different type of challenges. We call it a drop in the bucket. So you can recognize people across the whole organization. If somebody does something nice for you, if you see them going the extra mile for a customer or to help keep all of us safe, you can put their name in the bucket, and you have to write on the back why you're submitting that. And we share all that weekly in our meetings.
Yep.
So that's been helpful, and people are really getting on board with it, and they're enjoying sharing the stories across departments.
Yeah. Charles, anything that you guys are going to continue to do?
No, I agree with everything that's been said. And, but again, with your points too, Andrew, the PPP was great, and that will help counteract the unemployment, I would think too, because we did get some PPP money, and it helped us be able to pay people more for going out of their way to coming in and taking that risk, coming in and working, and then giving them the extra vacation time too, the time off. But yeah, it's right. And you guys are making me think more that I need to keep going. Of course, we're going to do more, the hand washing. You know, we probably made that little too, we never really watched our employees wash their hands, but we're realizing now that a lot of them do not even wash their hands unless they're told to. And then the other thing where I'm personally going to keep to do, one thing I didn't mention earlier, is I got to know families so much better during this because of the communication with getting their loved ones in. And I want to get to know them better. And I think that really helps our relationship because of the people we serve. So, but that's about it.
Yeah. Steve, anything?
Yeah, so one of the things that we do a lot is, and we haven't been able to do as much, we sponsor a lot of continuing education programs for social workers and other healthcare professionals. And we had historically done that, you know, using or, you know, partnering with a community. So whether, you know, like a nursing home or in assisted living, and then we would get the CEUs from the state. And so it didn't cost the social workers anything. Well, we had the opportunity during COVID to do a CEU event related to elderly suicide, and that's a new requirement for social workers. We have to have 2 hours of continuing education on that now. And so we did this, and we had over 150 people tune in on Zoom for the CEU. And so we saw this as an opportunity, because it can get more people their continuing education. It was more convenient, I think, for folks to do that. So I can see us, because that's something that we do to kind of give back to the community, to offer that as a way to, you know, for education purposes. So we're discussing kind of doing that and kind of gearing up our IT support for that.
Yeah, that's great. You got to look for creative ways to keep people educated and sharpen their sword, if you will. Mm-hmm. And I guess I'd echo what everybody says. I think I knew that our team were essential workforce. Now we've got government designating them as essential workforce. And so I think that's important for us as a society to recognize there's people in there that that had to continue to go to work and did so to risks to themselves. And we also took some PPP money and did incentive pay. So anybody who worked during the stay-at-home order got additional compensation for working during the stay-at-home order in St. Louis County. It's kind of how we delegated the timeline. We used PPP funding for that as well. So yeah, we all need to recognize those people who are really took that step out and continued to work in very trying times. So I want to thank the panelists. I'm going to send it back to Joan Pace, who's the guru of this meeting, and she can kind of do the quick wrap up here. So Joan, it's back to you.
Well, thanks, Andrew. What an amazing conversation, and we appreciate your involvement. Thank you, Andrew of Martha's Hands, and thanks also to our amazing panelists. Each segment, including this inaugural one within this series, will be recorded with a link to be posted on the Chamber website. Biz2Biz Adapting to Change will continue on Tuesday, July 28th with the focus on travel and tourism. To learn more or to register, please visit us at kirkwooddepear.com. On behalf of the Kirkwood-DePere Area Chamber, thank you for your commitment to our community.